of us who are joining, thank you for joining us today to the second portion of our four-part series, the Know Your Rights series. My name is Kimberly Blair. I am the Director of Public Policy and Advocacy for NAMI-NYC City. That stands for the National Alliance on Mental Illness of New York City. I am joined today by my wonderful colleague who I'll let introduce herself, Haley.
Hi, everyone. My name is Haley Amring. I am the Government Affairs Coordinator for NAMI-NYC State. Super excited to be joined by you all today. We have a lot of great things planned, so thanks so much.
Yeah, so it's just some housekeeping items for those who are joining. We want to make the most of the time we have. We have a jam-packed program for you today. We're going to have some wonderful, knowledgeable four speakers open up as to different concepts of supportive housing. Then we're going to take some Q&A, so some questions. If you at any point want your questions addressed during that Q&A portion, we advise you to please submit your questions in the chat. While the speakers are speaking, we have someone on our team who is fielding these questions and who will be compiling them together so that we can address them in the Q&A portion. So again, please do submit questions in the chat so that our four speakers can try their best to identify and address them. And so in addition to that, hello, welcome, yes. Haley, she sent out in an email prior to this. You all received the email because you're here, right? So everybody has the link. But in that same email, we have a pre-survey, and we're really hoping that everybody could take some time right now to fill out that pre-survey for the next couple minutes. It's really helpful for us to gauge your knowledge of mental health housing or supportive housing in general. Haley, also, thank you, Sophia. Some folks are saying in the chat that they have already filled it out. Thank you. So we have just put it again in the chat for those who have not filled it out. So we're asking for all participants to please fill that out in the next couple minutes while we're setting up. And then so while you're getting that going, let's introduce our speakers for the first half of the portion of today's event. We have from Shinny, all right, we have Cynthia Stewart, who is the COO. I'm going to just place a quick spotlight on her so that you can see. We have also joining us Sabrina Barrett. Sabrina Barrett from ACL. The speakers will be talking about their respective organizations when they first start their bit, so you'll get to learn more about what Supportive Housing Network of New York does and what each organization actually does. The Administration for Community Living, that's ACL. And then we also have Julie Duncan from OMH. OMH stands for the Office of Mental Health. So that is the New York State office. Welcome, Julie. And lastly, someone that I work very closely with and who I'm honored to have on this panel, Kat Corbell. Kat Corbell is an organizer here in New York City, and she has a lot of lived experience, both as an organizer and a tenant of supportive housing. So we're happy to have Kat Corbell from Shout New York City. Shout stands for Supportive Housing Organizers and United Tenants of New York City. So these are all the wonderful speakers we have for you today. And so let's just start off right away with Cynthia Stewart from Supportive Housing Network of New York, Shinny. Welcome, Cynthia.
Thank you so much. Everybody can hear me? Yes. Okay. So I really appreciate being asked to present here and love to see all these familiar faces. So my name is Cynthia Stewart, and I'm with the Supportive Housing Network of New York. And we are a small organization that represents 200 groups, nonprofits statewide. Many of them are here that build and run supportive housing in New York State. And 100 of them are in New York City, and the rest are in the balance of state. And collectively, they run 58,000 units of supportive housing. We do advocacy, we do learning sharing. We mostly connect government and network members with one another, and we help members with whatever they need help with in order to do what they do best. So I'm here to tell you a little bit about the beginnings of supportive housing and what it is. I've actually, as you can tell, lived a long time, and I've been talking about supportive housing for a very, very long time. Supportive housing got its start in the early 80s, at the beginning of really widespread homelessness. And at the very beginning of widespread homelessness, advocates were saying, oh, all people need is housing. And a couple of really smart people went out and interviewed people who were actually living in the streets and said, what is it that you really, really need? And they came up with the precept of supportive housing. People really wanted their own apartments. They wanted independence. They wanted to not have to participate in programs in order to stay housed, but they also wanted easy access to the myriad supports that are available that are really hard to access for everybody, let alone people who are struggling with issues. So that is the precept of supportive housing. People have their own apartments. They have access to support from caring staff who connect them to other resources in the community or provide those services themselves. They pay no more than 30% of their income toward rent, and the rest is subsidized. And yeah, that's the idea. So respectful and independent housing. And that is the whole idea of it. And it started out as a handful of nonprofit providers trying to think about this. And actually our organization got its start as a bunch of nonprofit organizations sitting around a table going, I have this problem, what are you doing about it? And they came together on a regular basis and really birthed this whole new version of housing. And the city thought, oh, well, this is much, much better than what we're doing. So we're going to fund it. And the state said, finally, this is much, much better than what we're doing. So we're going to fund it. It grew and grew and grew and grew. For us, we represent the nonprofits that run supportive housing. And so we represent nonprofits and think that they're the best and mission driven to provide the most respectful and important kind of housing. So that is sort of the birth story. From the very beginning, supportive housing has primarily served people living with mental illness. And that came about because a lot of people were deinstitutionalized, and the state did not find a way to create a concomitant amount of housing for people. And they ended up in single room occupancy hotels that were horrible and run by slumlords. And then those SROs were knocked down, and a lot of people ended up on the streets. And so the state had recognized that they needed to invest in this type of housing, as well as the other types of housing that Sabrina's going to talk to you about. But at the very beginning, they had a whole range of licensed and unlicensed housing. So supportive housing comes in two types, if you will. There is the supportive housing that is mostly that is a building in which the majority of tenants in New York City, it's usually 60% of the tenants are supportive tenants, and the other 40% are just low-income families or individuals. That we call that congregate or single site. And there are community rooms on site, there's gardens on site, there's staff on site, there's 24/7 front desk coverage on site, and staff is there. Staff is required to work with tenants, but tenants are not required to take services from staff. So that's an interesting kind of push-pull. But you're not required to talk to your case manager in order to keep your housing. So the other type of housing, which the Office of Mental Health called supported housing, which is really confusing. Sorry, Julie. And it is something called scattered site housing, in which nonprofits find apartments on the open market and sublet them or rent them, on behalf of tenants, and then provide mobile services to those tenants on a, whatever it is basis, but it's usually like once a month. So scattered site or supported housing, which I'm not going to use that term anymore because it's really confusing and everybody's going to go, but how's it different than supportive? So scattered site, has become, as we've had an affordable housing crisis, more and more difficult to provide in New York City, certainly, as rents have gone up and up and up. So, and in the very beginning of supportive housing, if I talk too long, tell me if I'm talking too long, just say that. At the very beginning of supportive housing, nonprofits took over old SROs and gut rehabbed them and turned them into supportive housing. But they are very old buildings, and they often have shared bathrooms and no kitchen facilities. And starting in about 2003, nonprofits started building new buildings, which are gorgeous and have lots of bells and whistles. And so anyway, SRO means single room occupancy, and it talks really about a form of housing that dates back to the 20s, I think, or even probably before that. So that, if anybody, so I think I have, so I wanted to talk about how you get into supportive housing. So in New York City, there's a very process of how to get into supportive housing, which is you have to fill out an application, which is otherwise known as a 2010E, which is not an easy thing, but a lot of supportive housing requires you to have been homeless for a period of time, and a lot of other supportive housing does not require homelessness. It requires some kind of disabling condition. So there, over 30 years, there's been, I think it's 28 different programs that have created supportive housing. So there's a whole range of different buildings and eligibility criteria, but there's one way in. So the city has been really quite clear on finding one way into supportive housing, which is through the 2010E, which is either, you don't need to know that. So, okay, so that's, and Sabrina can talk about how you get into supportive housing or other type of licensed housing outside of New York City. I'm really best to talk about New York City. No, supported housing is not the same as Section 8. Section 8 is just plain old, it's just a rental subsidy. Supported housing comes with mobile services from a nonprofit. So that, must the individual be diagnosed? Yes. Well, if the person needs to be, if you're moving into a supportive unit that is set aside for people living with mental illness, yes, there needs to be a diagnosis. I'm not going to read any more questions. I'm going to stop now.
Thanks so much, Cynthia. Really appreciate that. I know we could have this webinar go on for hours and hours with all the questions I'm sure people have. But next up, I want to transition to Sabrina Barrett. She's with the Association for Community Living.
Don't eat that. Hi, everyone. It's really wonderful to be here and talk about one of my favorite subjects, which is mental health housing. I had my video off because my internet was a little unstable, so it's on now, and hopefully I'll what we like to say at ACL is we believe a home is the foundation to recovery. And I'm getting another note. It's really wonderful to be represented here as fellow speak on my video. So we believe that housing is the foundation for recovery, and without a safe place to call home, to sleep at night, recovery really isn't as possible. And so it's important to us. At ACL, our members provide mental health housing to about 40,000 individuals all across the state. And I know these terms can be really confusing. I'm still learning them 3 years into my role, because it does seem like we use common terms and they're often changing their meaning, as Cynthia suggested. But at ACL, we like to say that all housing models are supported, because every type of housing has some type of support and services for the individuals who live there. And the housing is really meant to be along a continuum. We want to meet the individual where they are in that moment. And so we have various models that hopefully will be a good fit for everyone who needs housing. And so Cynthia touched on what we call unlicensed housing. I'm going to start by talking about licensed housing. And so again, it's across the spectrum, and the services provided are based on the needs of the individuals. So the first level is what we call congregate treatment housing. And this is meant to be transitional, because again, we hope that individuals come into the program and they receive the supports that they need to move on to more permanent and independent living. And so in congregate treatment, these are single site facilities. They can have shared or private bedrooms, and they can house up to 48 individuals. Meals are provided, on-site services for rehabilitation are provided, and there's 24-hour staff coverage. And so that's really sort of the first level or entry level for some folks. The next type of licensed housing that's also transitional is apartment treatment housing. And so similar to congregate, there's a high levels of support and skills training in a community-based setting. The average length of stay in this type of housing is 18 months. And while a resident is there, they learn the skills needed to move on to a more independent setting, how to access programs within the community, how to, perform tasks that like laundry and food preparation and cleanliness and things like that. The next type of licensed housing we call and we use a lot of, it's like alphabet soup. We use a lot of letters when we talk about our housing. The letters, and this type is SRO, which basically stands for a community residence that's single room occupancy. And while these can be traditional in nature, they're also, this is more of an extended stay. So folks can stay here longer than in the other types of housing. There's on-site services for these individuals. They're usually studio apartments or suites that have also shared living spaces, like community spaces within the residence. At the CRSRO, there will be 24-hour front desk security and services like case management, training on daily living skills is available. So those are the three types of licensed housing that I wanted to cover. And then Cynthia touched on the unlicensed housing, which, as she talked about, really is a more independent living where there is support available, but a resident isn't required to access that support. As she stated, the staff are required to be there and be available, but it's at the other end of that continuum of housing where it's more permanent and people get there, are ready for that type of living situation. So as far as how to get into different types of housing, and I see a question about, is there housing in Albany? There absolutely is housing in the capital region. Mental health housing is divided among 5 regions across the state. And the process for accessing housing differs depending on where you are. And so that's why I'm so glad that we have, I'm going to try my video again. That's why I'm so glad we have some of ACL and Chitty members here with us today who can talk more specifically about how one goes about accessing the housing in that specific region. I don't want to get into that too much because, again, it really does differ depending on where you are. Oh, and I see my acronym cut out. So maybe that's when I was talking about CRSROs, which are community residence single room occupancy. Apologies, I'm not great. I don't have a great internet connection today. So yeah, that's really the long and short of it. So I will pass it along to whomever is next.
Thanks so much, Sabrina. I know there's so much to go over in this, and luckily for everyone too, if you stick around till the end, we do have a resource guide in case you haven't seen it in your email yet. Next, I would like to pass it along. In our budget this year, there have been a lot of really significant investments when it comes to mental health access, especially, and not short of that is the investments recently made for mental health housing. So we have Julie Duncan here with the New York State Office of Mental Health to talk a little bit more about the recent investments made in the budget.
Great. Thank you so much, Haley. I appreciate the invitation to be here today. I really appreciate everybody taking a little time out of your day to join the conversation. So as Haley mentioned, I'm going to talk a little bit about what is in the budget this year. And then if time allows, I think they were also looking for me to touch on our crisis system a little bit. So let me start with the budget. As Sabrina just said, and as Cynthia really indicated before her, it is really the philosophy of the Office of Mental Health that the bedrock of mental well-being is really having safe, affordable housing. It's really hard to focus any energy on any higher level needs if you're worrying about where you're going to sleep at night. So and that philosophy is shared from the commissioner on down, and even I'd say the governor on down, because this year the governor really put her money where her mouth is, so to speak. And within the budget this year, there is over $1 billion invested to expand the mental health system in New York State. And the overwhelming majority of that money is going specifically to housing. So I'll talk through the different the housing initiatives more specifically in the budget, but I do just want to mention that the initiatives are much more expansive than housing. There's a lot of money invested in other community services to kind of fill in the gaps in the system that are out there, so people can have the supports that they need to live in the community and live successfully and live the most productive and meaningful lives that they can. There's also a focus on improving the psychiatric emergency system and the inpatient system. The goal is always to avoid that level of hospitalization, but sometimes that's a necessary component of care. And when that occurs, we want to make sure that it's the highest quality care possible, and that the outcomes when somebody is able to leave the hospital and transition back home, that they're the best possible outcomes. So we're kind of working on bolstering the entire system, and we're really trying to do it in a manner that is not siloed, and considering all of these other different initiatives, putting them together in a way that is as logical and supportive. So it's not just we're doing a little bit of this here, we're doing a little bit of that there. We're really trying to be planful about how we go about all of these initiatives in the budget. So specific to housing in the budget, and I just want to mention, Cynthia, you're absolutely right. It's totally confusing to say supportive. So we actually don't say supported anymore. We say scattered site supportive housing or congregate supportive housing or SPSRO. So within the entire budget, there's funding to expand mental health housing by 3,500 units. So 1,500 of those are the unlicensed housing that Cynthia was talking about. So half, 750, are that scattered site model, those apartments that you rent in the community. And 750 of those units are that single site or congregate site setting where there's also affordable housing in the building. And then for the licensed models that Sabrina talked about, we're expanding the licensed treatment apartment program by 600 units. And these numbers are all statewide. So part of the work that we're doing is figuring out how to allocate these resources across the state. The needs of different communities are different. So some models work better in some communities, some models work better in others. So that's part of the work that we're doing right now, is figuring out how to best utilize these resources to meet the different needs. So there's 600 of those licensed apartments. And then there's 500 of the CRSRO units that Sabrina talked about. So also the licensed model, transitional programs, but a longer stay than some of the other models. And the final initiative related to housing in the budget is this brand new model we're currently calling short-term transitional residence. I keep making a pitch for somebody to come up with a better name for it, and nobody has made the suggestion yet. So if anybody has one, I'd love to hear it. But this is a brand new model. So this is, as the name implied, a short-term program. So we're envisioning these as being up to 120 days. And we're looking at using them in a bunch of different ways, but I think the focus is going to be on periods of transitions for individuals. So I think we'll have some programs that are a resource for folks that are stepping down from hospitalization. So, they don't need to be in the hospital any longer, but they could use some added supports before they're able to transition on to more permanent settings. And I should just back up a little bit and mention this model, this short-term transitional model, is going to have enhanced staffing, including clinical staff and peer staff. So there's a larger staff, probably nursing. So there's a larger staffing component than you would see in even what is currently our most staffing rich model, which is the community resident. So it's really about providing folks with intense supports and intense skill building in a short period of time to help them successfully move through that period of transition. So as I mentioned, I think we'll use it for step downs from hospitalizations. We may use it for individuals transitioning out of like the children's system. They're not quite ready for independent housing. So there's a whole bunch of different ways that we're looking to use it. I know I'm running short on time, so I also just want to touch on crisis real quick. So the last couple of years, OMH has really focused on expanding the crisis system and implementing a comprehensive crisis system across the state. So that includes telephonic crisis. You can call somebody, you can call 988 for support in a crisis, mobile crisis, so a team of mental health professionals comes to you when you're in crisis. And then there's also crisis residential programs, which are like a 28-day program for anybody that is in a behavioral health crisis. And that could look like a bunch of different things. It could look like, you know, somebody who may be trending towards going in the hospital and diverting somewhere else, or I mean, even somebody that's having roommate issues and that's just exacerbating their stress and they need a breakaway. So those crisis residential programs are available statewide, and we're currently expanding those. And I don't want to go over time. I want to be respectful, so I'm going to stop there.
Thank you so much. And thank you so much for joining us, Julie, and providing that insight. It's really kind of a breath of fresh air to see our governor's commitment towards more mental health services statewide, including mental health housing. So we really appreciate you here and just going more into the details. All right, and next up, I would just love to introduce Kat Corbell from Shout NYC to talk more about the tenant's perspective. What is Shout NYC? How is it a resource to people statewide? And what are some of the movements that we're seeing in terms of the tenants organizing and knowing about their rights? So Kat, I'll have you take it away.
Good evening, everyone. So as Kimberly mentioned, my name is Kat, and I'm with Shout. It's the supportive housing organized and United Tenants in New York. So we formed in April of 2021, and we're a network of supportive housing, both tenants and applicants. And now we also have former tenants that are part of our allies, and we have a wide range allies of social workers and some lawyers, legal advocates, paralegals that are all like basically supporting the supportive housing, the tenants and the applicants. So we ended up before we even became known as Shout, we helped, we were like sort of discussing on what our needs were. What were we needing? Why were we not being heard? Or we felt that we were not being heard. And a lot of the lawyers could not, you know, break their confidentiality and tell us who to go talk to or to go talk to each other, because they had, you know, the confidentiality clause lawyers are stuck with, like doctors are stuck with. And so they ended up getting together on, this is like during COVID, so we couldn't meet in person. So we met on Zoom and had like, I think over 100 people on a Zoom call. And that's how we ended up forming in April of 2021 and deciding what our needs were. What did we need? What did we want? What were we trying to accomplish? And that became what's now known as Local Laws 3 and 15. And it really was down to the wire at the end of December 2021. Like the very last city council meeting is when we were able to get these passed, like at the last, like literally down to the wire. I'll talk about those two more in a second, but some of the other things just about how Shout is organized right now is we currently have 3 committees. It's the Know Your Rights Committee. It also does a little bit of peer support, but peer support's just now starting to become its own committee as well. We've created and led tenant rights trainings. We've created Know Your Rights magnets. We're also starting to create a tenant rights handbook. We have a legislative and policy committee. We've been meeting with all local agencies regulating the supportive housing in New York City. We've launched a safe supportive housing campaign just the end of April of this year. We also have a media committee. We've published a first op-ed on supportive housing tenants' rights. We've spoken to journalists in approximately 10 articles about supportive housing issues so far. We recently started a tenant-only supportive housing support group, and it's currently online. And so it sounds like a lot, but we have more planned for this year and planned for after this year. We've had like some trainings we've had. So we have more to do, that's for sure. So the one big question is, why is it important for supportive housing tenants to organize? And the one thing we keep reminding ourselves, and especially reminding everyone else, is that supportive housing tenants' rights are tenants' rights. We had one of the purposes of the local laws is to become recognized as tenants. So fighting for the rights of supportive housing tenants strengthens the rights of all tenants. We also are, fighting for the racial, economic, and disability justice. It helps build solidarity. It can help cut through isolation. Many supportive housing tenants are isolated from other tenants. Some of us, even some of the tenants in my building, have said that they hear that from the supportive housing provider. The supportive housing providers do not want tenants to talk to each other. They try to keep us from communicating with each other. So we just keep trying to, to organize, to communicate, to build solidarity. So we just kind of like keep trying to build bridges to keep, working together. And then the supportive housing tenant community has also has not been incorporated into housing rights spaces. So we've been working on that, developing other, getting other tenant rights groups to recognize how to include supportive housing or to be more inclusive of supportive housing. So that's been something that we've been able to achieve over the past 2 years. And then we always like to think of when we thought we won, because when we fight, we win. So when one of the things we like to think of is how should providers support tenant organizing? So one of the things is to have independent and tenant-driven spaces for confidentiality and privacy. So no providers in meetings, not having providers mandate that they be in meetings or be organizing the meetings or like have to be in the meetings. No tokenizing, no having a token resident be the one, like, oh, because I have this one favorite tenant, I'm gonna be okay and like, be my source of information or anything like that. Be transparent, share documentation of all concerns, support tenants to organize, have a policy against retaliation, just completely no retaliation at all. And that's been something that's present to this day. There is retaliation against some of us that are in meetings with organizers of, not organizers, but with some of these meetings like OMH and Shinny and DOHMH. As soon as our housing providers hear we are meeting with these organizations, we're the first ones to start getting eviction notices. So the retaliation is present, is real. So we need to try and have an official policy against that the providers will honor and recognize. And accountability to tenant-initiated policy changes and follow through, because tenants are the ones with lived experience. Their lived experience to get into supportive housing. We're the ones with lived experiences to know what really happens in supportive housing. Not the CEOs that go make beautiful pitch speeches to city council of how great everything is. We're the ones who know what happens when everyone leaves at 5 o'clock. So we need to be heard about the 112 degrees on our heater right now after May 31st. So we need to be able to have a policy change for when to actually have things happen for what we need for safe housing, safer housing, I should say. And So the next, one of the things we did was get, through donations, we were able to have some magnets. We helped collectively design these. This is just like a summary of, like for Know Your Rights, the Know Your Rights goes on and on, but these are some magnets that some people were able to have the costs donated for. And these are, in my apartment, they're on the door because I have a magnetic door. We also encourage people to keep them on the refrigerators. And it's just to remind people of, you know, what they have the right to. Some of the supportive housing providers are directly the landlords. Other times there's a third party landlord, and some of them are trying to get them evicted without going to housing court. So this can help remind them, if somebody tries to evict you, you have the right to have, you know, a housing court appearance. You have the right to have a lawyer. You know, things just to keep remind them, if a landlord comes to their door demanding entry, they have the right to say no. Things like that, to just try to help them remain calm, to remain, you know, to just call one of the shout partners if they need to like handle dealing with the landlord or housing provider. And then the reasonable accommodations is a big one. We keep hearing over and over again, a lot of supportive housing landlords and supportive housing providers refuse reasonable accommodations. They will deny them, they will not support them, they will not provide them the forms to fill them out, ranging from needing an elevator building, needing an emotional support animal. Some of them will refuse a service animal. They'll say their landlords deny service animals even. So that's one of the ones that we keep having a lot of training specifically about. So the next slide, I can talk briefly about the local law 3 is the mandating the reporting on supportive housing rejections. If you guys ever have time to read it, it's 99 pages, but it's a lot of information. Local law 15 is the one that is supposed to be able to provide all tenants in supportive housing their own customized supportive housing Bill of Rights. There's an issue with state-funded supportive housing providers that we're still working on, but if you are in a city-funded supportive housing, you're supposed to be able to get your own Bill of Rights. And I know I'm about to run out of time, but definitely check out the Shouts website. That can, if you have a problem getting your own copy of your, and Kim, feel free to step in for me if I'm not remembering things, because now I'm in a rush. But if you live in supportive housing, or if you apply for supportive housing, or if you just come across a supportive housing like apartment and you want to have a copy of those Bill of Rights, you are supposed to be able to request it. And if they do not give it to you, then you can call 311 to document it, that they did not give you a copy of that Bill of Rights. And there is not one universal applies to every single Bill of Rights provider, because everyone is unique. Every supportive housing placement has a different policy or has a different emergency phone number to call in case there's an emergency, like your upstairs neighbor flooded your apartment for the 5th time in 2 years. So everyone's going to have a different emergency contact. So that's why there's not one complete universal set that applies to all. The numbers range between 58,000 and 200,000 supportive housing people in New York City. But it's a model, so it's something that other people can take over, especially if we get this to go beyond New York City.
Thank you so much, Kat. Thank you for your participation. Thank you for sharing your lived experience. I see in the chat, for those who are interested in learning more about reasonable accommodations, we have another presentation available from Shani as well, about reasonable accommodations. So thank you so much, Kat. We are providing the Shout resources in the follow-up materials that you all will be receiving via email this week. And so we're running a little bit behind, so we're going to limit Q&A really to 5 questions. I'm going to actually add a spotlight to all of our main speakers really quickly to make sure that we, if it lets me, so that we can get some questions answered. So I need to bring Kat back up in here if possible. Haley, could you, yes, we're gonna do breakout rooms by region. So we're going to move to that next, but just quickly, can someone please bring, thank you. So we have here, what happens if the applicants of supportive housing have children? Who wants to take that on? Sabrina? Cynthia?
Sure. Most supportive housing in, in the state of New York is actually for single individuals, but there is a portion of supportive housing for families. So yes, there's supportive housing for people with children.
Awesome. Do Julie or Sabrina want to add anything about the statewide perspective?
Oh, that's statewide.
Oh, it's statewide.
Yeah, that's
Okay.
statewide. The only thing I would add is that we can also, it doesn't happen to come up very often, but there are occasions we can accommodate families in our licensed apartment program as well.
Thank you. Next question. What are some steps that someone can take before applying for supportive housing? Are there alternatives?
I guess I'm not sure what the intention of the question is there, so supportive housing is.
I can rephrase.
Yeah.
And so are you saying that other resources must be exhausted first before applying for supportive housing? I think that's what they were trying to get at.
Gotcha. I don't want to, if Cynthia wants to answer, I don't want to step in any toes, but I think in general, the intention is, supportive housing is intended for any individual that needs the supports to be successfully housed and the rental stipend. And so, no, you don't have to exhaust other options. Cynthia did mention there are some units specifically in New York City that are designated for homeless individuals. But that's not all of the units in the system.
Thank you.
Kat, were you trying to, it looks like maybe you were trying to say something?
The only question, or like the only thing I would note too is for those of us in the city and or the state seems to constantly change the 2010 process. Every time I turn around, there's a new policy where you have to go to the same agency to help you apply for all 5 parts, or you don't. So I don't know what the latest answer is. But when I tried to apply for it, the first agency that was trying to help me apply had a completely bizarre, like, oh, well, you have to prove that you're homeless or street homeless. So you have to come for over a 5-month period. So we really want to see you on the streets for 5 months with your emotional support animal to like document how street homeless you are. And then I met someone else who was like, no, that is inaccurate. That is their own interpretation of the policy. So if you're having someone, if you're not jiving with someone, I would suggest just to find someone else that can help you with the 2010 a lot better, because there's like a lot of different agencies that can help with the 2010. Mm-hmm. So if it's someone like that's trying to tell you something that has apparently no lived experience or a lot less lived experience than you, find another agency that has better lived experience and is more down to earth with New York City than like come back and see us in 5 months, or we'll do each part of the 2010 one at a time over 5 months. That's not realistic in New York, in my opinion, in a New York City.
Right. And I just want to say thank you for that perspective, because obviously we have on paper what we're promoting and what is supposed to be the protocol. And then we also are bringing in lived experience because we want the folks on this call to really be equipped with real world knowledge. So I do want to let Cynthia chime in, and then we're going to have to move on to the breakout sessions.
I don't have anything particular to add, but yeah, I agree with you, Kat. You have to go to a, trusted provider that knows what they're doing in terms of 2010. Don't just ask anybody on the street.
Yeah, definitely. Let me see if there's just time for one more. I think that this one is for Kat. You kind of alluded to it. Do tenants have rights with emotional support animals and service animals?
So service animals are protected under, like protected / provided under the Americans with Disabilities Act. And service animals are basically protected any public space, but it includes housing and shelters and restaurants, CVS, Targets. Washington, DC is another story I can talk to you offline about, but it's fun, trust me. Emotional support animals are protected under the Fair Housing Act, and that applies to anywhere that you can live for 30 days or more. Even if the city HRA tries to fight that, we win. So that's any shelter that you stay at for 30 days or more. Hotels do not like it, but that's why hotels only let you stay for 28 days, so they do not consider you a tenant. So again, the support animals are for under the Fair Housing Act, and then the service animals are limited to dogs and miniature horses. So that's the other caveat. So that's why even if a cat can detect you having a seizure, the cat has to only be limited to an emotional support animal, even if it is detecting a seizure about to happen, or can smell an infection. They don't care. They're going to provide you emotional support so that you're emotionally supported when you're having a seizure or smelling an infection.
Thank you so much for providing that insight. And thank you to all of our speakers. A virtual round of applause. Can we get some? Yeah, I love that. All right, so thank you to everyone. And so what we're gonna do now is we're gonna make the breakout sessions live. We know we're behind on time. So what we're gonna do is we're actually going to just give you the rest of the time until 7:30 to really meet with your respective groups. And anybody who needs support will be in the main room. Haley and I will be popping up in different breakout rooms to make sure everything's going smoothly. But please do enter the respective region that you live in. So we have Western New York, Central New York, Capital Region, Lower Hudson, Mid Hudson, Long Island, and New York City. Thank you.